My name is Devin, and I'm here among friends. Welcome, and thank you for joining us in this event, which is part of our week of action. My name is Dr. Devin Ojeda, and my pronouns are they, them. And I'm here with four providers who work in healthcare services to share their stories and to share why non discrimination protections are essential in healthcare services. Before we begin, I want to start by recognizing this land and doing a land recognition. As we gather in this virtual space, we must acknowledge that the ground beneath our feet is historically the home of Indigenous peoples, many of whom have been forced to leave for other lands. Native nations negotiated government to government preserving their sovereign land, rights, and privileges through treaties. When the land wasn't succeeded through treaties, it was stolen from our indigenous relatives. This acknowledgement recognizes the first caretakers of this land, the suffering they endured, and the sacrifices made by Native people. I'm currently an uninvited guest on the land of the Anacostans people. The Anacostan culture spanned the entire region known today as Washington, D.C. May we remember that Indigenous peoples are not a people of the past, but are here with us now, continuing to demonstrate their talents and gifts amidst a background of ongoing colonialism and oppression. If Indigenous people are on this video chat, if there are any Indigenous people, you're invited to share your tribe in the chat so we may recognize that you are here. I hope this land acknowledgement statement will inspire others to stand in solidarity with Native nations. Solidarity looks like this: donating time and money to Indigenous led organizations and communities, amplifying the voices of Indigenous people, leading grassroots to change movements, intentionally learn about the rich history of Indigenous peoples that inhabited and cared for the land you currently stand on, include space for meaningful land acknowledgements in your events and presentations, like we are doing right now, and in returning lands to its original stewards. So thank you so much for allowing me to recognize the land. Now we can begin by introducing our guest. We can start with Dr. Lin Fan Wang. If you want to start to introduce yourself, you're welcome to.
Yeah, sure. Hi, thank you so much for having me here. And I'm currently on Lenape land. So my name is Dr. Lin Fan Wang. My pronouns are she and hers. I am a family physician who is currently in the Philadelphia area. I provide gender-affirming healthcare at CareerDoc, which is a telehealth company. I am also an abortion provider that works at various Planned Parenthood clinics throughout the southeastern Pennsylvania area. It's so good to join you all.
Thank you so much for joining us. Next, we'll hear from Dr. Quinn Jackson. Go ahead and introduce yourself.
Thanks. Yeah, really excited to be here and talk with everybody. My name's Quinn Jackson. I use he and they pronouns. I am a family physician in Kansas, and I provide gender-affirming hormone care to teens and adults. I'm also working to expand primary care access and obstetric care access for LGBT people in Kansas.
Wonderful. Next, we'll have Dr. Noel Marie Javier.
Hi, everyone. Thanks so much for inviting me. It's such a great honor and thrilled to be part of this esteemed panel. My name is Noel Marie. My pronouns are she, her, hers. And I also recognize that I am actually sitting on the land in Manhattan, which is in New York City. I am an internal medicine provider. I'm also a geriatric medicine provider and a hospice and palliative medicine provider. And this is such a great opportunity to join this wonderful panel and share my thoughts, my views, and my advocacy around this work. Thank you.
Thank you. And last, well, not last, because we're going to go introduce Ben afterwards, but out of our providers, last but not least, Jonah Tangwe. Go ahead and introduce yourself.
Hello, everyone. My name is Yona Tangi. My pronouns are they, them. I'm a healthcare provider at Whitman Walker Health, where we practice from a comprehensive primary care model. I provide HIV PrEP care, gender affirming care, ages 13 and up, so for youth as well as adults, and also for geriatric patients as well. And then we also provide care for people living with substance use disorders. And then I'm also the Vice President for Education at GLMA, Health Providers Advancing LGBTQ Equality.
Well, thank you so much for all the work that you do. We will ask our panelists a few questions in just a few minutes, but first I want to let Ben from Whitman Walker introduce themselves and talk more about what Section 1557 is.
Thanks.
Take it away, Ben.
Thank you so much, Dee. I'm happy to be able to drop in and provide your policy moment over here. My name is Benjamin Brooks. I use he, him pronouns. And I acknowledge that I'm on unceded land of the Anacostan and Piscataway people in Washington, D.C. I think I shared that I use he, him pronouns. I'll share that the Whitman Walker Institute is the policy, education, and research arm of Whitman Walker Health, where Yona is also a practitioner. So I am here to talk to you about Section 1557 of the Affordable Care Act. We call this the Healthcare Rights Law. So 1557 provides protections for people who experience discrimination, marginalization historically in the United States healthcare system. So that includes age, race, and importantly for us, sex, among other sets of protective features that many people have seen. It also provides protections for people living with HIV or any other conditions. It used to be that health insurers and healthcare practitioners could turn people away from care and from their businesses arbitrarily. But now, under the Affordable Care Act, since 2010, when it was passed, and then the first regulations codifying the healthcare rights law into law were promulgated in 2016. And so what we're here to do is to strengthen those regulations again in 2022. Folks may have heard that in 2020, the Trump administration promulgated a set of regulations that removed many of those protections, explicit protections for LGBTQ people. And so this panel and this really this opportunity is for us as LGBTQ people around the United States and around the world to share our stories about why non-discrimination is so important for access to our healthcare. There are some pretty stunning experiences and stories that we've heard over the course of collecting information to support strong non-discrimination protections. But one of the key pieces here is that a large percentage of LGBTQ people fear going to a medical provider because they think that they may be discriminated against. And so what we're really fighting for here is the right to access healthcare without fear. So I will leave it to the rest of our brilliant practitioners to go into detail about the kinds of stories and experiences that we're looking for. But ultimately, we're trying to share our voices loud and clear so that the Biden administration knows that everyone from coast to coast deserves to be protected when they go to receive healthcare. Thank you so much.
Thank you so much, Ben. It's great seeing you. I hope you have a good rest of your evening. Alrighty, so we heard from Ben from Whitman Walker, and this is why we need your help to share your support to protect trans people in healthcare. But if that doesn't convince you, maybe these amazing panelists will. I'll begin my questions to the panelists about why we're here. I don't know who wants to start with the first question, which is, what does Section 1557 mean for your work in your workplace? Does anybody want to start, or should I pick on somebody? Dr. Wang, do you want to start since you nodded your head?
Sure. I was saying, like, yes, pick on us, please, because I think we all don't want to talk over each other. So later on, we have another question where I will address what the Affordable Care Act has meant in Pennsylvania. But first, I just wanted to just touch upon everything that this new ruling would have and the impact they would have on our patients who are transgender and non-binary. So not only does it not allow discrimination based on gender identity, but it also has all sorts of other protections that also affect our patients. And so one is that it doesn't allow discrimination based on pregnancy or other pregnancy-related conditions, including pregnancy termination. And so we know that our patients who are transgender, who have uteruses, do become pregnant, do desire pregnancy, or they become pregnant and do not want to become pregnant and have abortions. And so for these patients, it is as important for them to not experience discrimination based on their experiences with pregnancy. Because of transphobia, stigma, and discrimination, we also have a good population of patients who come to the US for asylum. They may speak other languages, they may have experienced trauma. And so for them, this new ruling would also require that healthcare providers provide languages in the language that is most understandable to our patients. And they would also require accommodations for physical and emotional disabilities. And then another piece that's important for me is that I provide telehealth services in many states. And so we know that our patients who are in rural areas often have a hard time making it into our clinics, or they have a hard time finding a provider near them who understands all of their healthcare conditions. And so this new ruling would also require that clinics provide telehealth, which is a really important way for patients who have transportation issues to be able to access care that is all-encompassing for their healthcare needs.
Thank you so much. Anyone else wants to answer a question? Dr. Javier, do you have anything you want to say about this question?
Yeah, I think so. I will be answering this question coming from two angles. One, being a provider, and also being a woman of trans experience. I think that I can definitely relate to this. So my scope of expertise is really along inpatient medicine, inpatient work around adult medicine, geriatrics, and palliative medicine. And we all know that, a lot of, at least in my scope of practice, that individuals who are admitted to the hospital may or may not be on gender affirming therapies. And if they are on gender affirming therapies, then it is incumbent upon us as providers to be able to make sure that we accommodate their gender affirming therapies and include them in the daily plan of care and not get in the way of that. And I think that, segueing into sort of the outpatient setting, because I work a lot with outpatient providers as well as we're transitioning from one setting to another. I think that having this section in Obamacare solidified and codified in a way that will allow inclusive and affirming care for trans and non-binary individuals, this will definitely protect access to affirming therapies, and also other interventions that will come into play. Lastly, I will say that in the areas of serious illness and when people get older, there's always a question about continuing gender affirming therapies in light of their underlying illnesses. And I think that, this protection will certainly cement the reality that having a serious illness is not a barrier to continuing affirming therapies for as long as there is shared decision making and a collaborative approach between the provider, the patient, and the caregiver or the chosen family or family of origin, whoever is the support network. So I think that I could not overemphasize the magnitude of this law.
Jonah, is there anything else you wanted to add to this question, or any words?
Yeah, I think the only thing I'd want to add is that I think that's so important about this is it's giving people a recourse, but being like making them seen in the law. I think so often for so many of my patients, for so many people who like identify under the gender expansive spectrum, that they feel that there is no recourse for them if something happens. And so to have this like sort of before they even get to that healthcare space, as they're considering whether or not they feel safe going to care, knowing that there is something codified, that there are protections for them, and that there should be some recourse if something does happen to them. I think that's going to be so valuable at the like personal level for so many people, because I think so oftentimes, especially depending on your geographic region, it oftentimes feels for so many trans people like if something happens to them, there is no one that's going to care. The police aren't going to care. Other systems are not going to care. There's not going to be a support system for them. And so I think this will be a really great way to hopefully show that we're at least moving in the right direction again, to providing some of that support.
Dr. Jackson, is there anything else to add to this question?
Yeah, I appreciated their comment about how your experiences in healthcare as a trans person anywhere are really scary, but depending on your geographic location, they can be extremely isolating and really feel like you have no one who has your back. And I certainly don't want to share stories of my patients that I haven't gotten consent to share, but I think we all have heard stories of providers who blatantly misgender people, who refuse to use appropriate language for their bodies, who just know nothing about trans care and have to be educated by the patient, even as severe as outright refusals of care for things that have nothing to do with being trans. Physical, verbal assault, even sexual assault. And the bottom line is that everyone deserves respectful healthcare, no matter who they are. And this protection would afford that to a whole host of people. We're focusing on trans people tonight. But because of all the protections, it will really impact a whole lot of people, as well as our most marginalized patients who occupy many of those identities at the same time.
Before we move on to the next question, and thank you so much, Dr. Jackson. I just wanted to flag, someone mentioned that healthcare facilities need to do a better job in addressing social determinants of health. And many TCNC healthcare providers offer care to people of color and yet fail to hire providers that in which look and can relate to the patient population they're serving. There are people of color on this panel, but I wanted to maybe direct to you all what your thoughts are about providers being of color as well, and why that might be important for a lot of our patients. And I'm sorry for derailing, but I just saw this comment and wanted to highlight it. I don't know who wants to go. Dr. Wang and Dr. Javier in particular. Do you have any comments around that comment in particular?
Would you like to take that first, since I took it last time?
Sure.
Yeah.
So I think it's really important for people to see a mirror of themselves, with visibility and representation, because I think that speaks a lot to the type of health system that they're seeking medical care in. And being a woman who's got a triple minority, being Asian, being trans experience, being a woman, I think that the intersectionality of my identities is is a great representation of celebrating who I am as a person first and foremost, and then also as a healthcare professional serving a wide variety of individuals. I live in a state that is very heterogeneous and very cosmopolitan, from all walks of life, from very diverse backgrounds. And, even though New York, New York is not unique in that sense, because there are other states as well that are very inclusive and expansive in terms of different cultures. And I think that having that representation of different identities can, well, first of all, potentially solidify that trust that health systems are inclusive and affirming. And at the same time, I think, again, I can only speak for myself as a provider as well, that I also understand the lived experiences of a lot of the individuals who also carry the same type of marginalized identities as I do, though I don't claim to walk in their footsteps, because we all have different lived experiences. But at least I come from a lens of being able to understand the minority stressors, and in the intersectionality of their different identities. So I think that it's incredibly important, to see providers who can reflect their own identities towards others and patients towards us.
Yeah, thank you for this question and for giving us the space to respond to this. So there are so many ways to respond, and so I'll try to keep my remarks concise. But studies have shown that female physicians, actually their patients have better health outcomes, and Black physicians, when for their Black patients, their patients have better health outcomes when compared to Black patients who have white clinicians. And so there is, right, so there is evidence and data to support this. But on sort of to broaden it, right, is that diversity makes us all stronger, right? Because diversity allows us to have more viewpoints, more ways of thinking, to be able to provide care to a wider population, right? And to really take care of everyone in the way that they want. And really, when we look at this, at the research around why do patients who have clinicians whose backgrounds reflect their experiences, right? What they find is that it's because they're listened to, they're understood, they're trusted. And so it is for all of us, right? It's really about trusting our patients. It's about listening to them, really understanding where they're coming from, what their values are, what they find important. And if we're able to start from that baseline and that foundation, then we can really grow from there.
Wonderful. I just wanted to acknowledge that, but we will be answering questions at the end of this as well. I guess the next question I have is, what does trans-inclusivity looks like in healthcare? So, for example, what does it look like when trans and non-binary are excluded or harmed in healthcare? And please, share some examples of discrimination and harm that you have seen and experienced in healthcare. I'll begin it with Jonah. What does trans-inclusivity in healthcare looks like for you, and what is the discrimination that trans and non-binary folks experience?
I think it'd be very hard to sum all of that in a short, concise response. But, I think kind of almost piggybacking a little bit off the last thing that we were talking about, it goes, but when it comes to any marginalized identity, it's not just at the end when we're thinking about inclusivity and who's working. It really has to start at the beginning. If we're thinking about why there aren't more people of trans experience who are healthcare providers, why there aren't more people of color who are healthcare providers, it's because they are not given the same opportunities from a very young age. And so, especially in this country, if we're thinking about those structural systems of violence, at every step of the way, they're really thinning out the herd in terms of making the kind of space that we want to make, making a space that's affirming and where people can see themselves regardless of their identity. And I think that is just so insidious in this specific culture, and it's really hard to fix. And it's something that you can't really fix just with hiring practices alone, but you really have to think about it structurally and put it into everything and every single part of what we do. And what do I think might be an affirming space for people? I think that the small steps are great, change is incremental. Things like thinking about forms, things like thinking about pronoun badges, trying to have an inclusive workforce, diversity training, etc. But I think that there's no one easy fix. I think it's about really starting from those roots and working from our ground, from the ground up, in order to make things different.
Thank you so much. Dr. Jackson, same question. What has been your experience, and what does trans-inclusivity looks like in healthcare?
Yeah, absolutely. So I agree that small changes can really add up over time, but also dream big, right? I fully believe that healthcare can be a space where people feel loved and supported and cared for. And I really dream of a time and place where trans people, people of color, every kind of person that exists feels excited to go to the doctor and feels loved by their provider. And I think that those spaces are something that we can create with a lot of intention and a lot of work, but also there's a lot of joy in doing that work. I also, in some ways, feel like the most affirming space is one where, your status as a trans person isn't that important to your healthcare provider, right? Where we're people first, who are, like Dr. Wang said, who are listened to, who are believed, who are valued for the experience that they have. And I think we can create that, and agree with the comments about kind of the issue with the pipeline of kind of fixing our educational systems and how they are really designed to work for a certain type of person and designed to exclude people who don't fit that mold. And we just really have to do a lot of work to change that.
Thank you so much for your comment. I really appreciate it. Dr. Javier, same question. What does trans-inclusivity looks like, and are there stories of discrimination that you think about? The floor is yours.
Yeah, thank you so much. I do want to acknowledge this. I'm reading the comments, and I think one of our attendees, Maya Leilani, I recognize the comment, and I acknowledge that my experience, what she meant in terms of people of color, are those individuals with dark skin and may have racial ethnicities of being Latinx or African American or African. And I totally agree that my experience as a provider and a patient of trans experience is going to be incredibly different from somebody who is darker skinned. And I will acknowledge, and I will be honest and humble enough to say that people of color who are dark skinned are much more marginalized than I am. And and the cohort of individuals of trans or gender non-binary of the same color. So I wanted to just acknowledge that. So going back to your question, Devin, so in terms of trans inclusivity, I think it really starts with representation around SOGI, right? That has to be incorporated into our electronic medical records, our intake forms. We need to have visible indicators in our practice settings, whether it's pronoun badges, whether it's magazines, paraphernalia. The one thing that I really like about the institution that I work for in New York City is that the moment you walk into the main lobby, on the left-hand side, and plastered in the wall is the LGBTQ healthcare Bill of Rights, which is adopted from, Patient Bill of Rights, but it's refashioned or redesigned in a way that is LGBTQ, and it's super huge that you can't miss it the moment that you walk in. That's what you see. I think that that's really important as a way to signify that individuals are who belong to the LGBTQ plus population, and especially the trans and gender non-binary, because it's our focus of conversation tonight. will feel comfortable that this is in fact a safe space. I think engaging in diversity training, DEI, diversity, equity, and inclusion training, unconscious bias training, with from all sides of the healthcare systems, from administrators to transport to physicians to physician associates, nurse practitioner, nurses. Really, everyone has to have that grassroots training. And because there's also a huge turnover in terms of the healthcare settings, we need to have this in a repetitive and cyclical way, so that we can target all the newbies who are newly recruited and they can be in the know. We also have to understand that a lot of our employees come from various backgrounds, and some of them might not even really fully comprehend the lived experiences of trans and non-binary individuals. And it's not because that they don't want to. It's just because it's a culture that they never probably were even exposed to. So making sure, particularly in the nursing home settings, part of care for me as a geriatrician is always looking after inclusive and affirming care in long-term care settings, where we know that majority of medical providers there, whether they're nurses or patient care associates, are people of color and come from different backgrounds. So I think that it's really, really important to engage in training. This is not a one-time investment. This is something that is recurring. And the other thing that we also need to ensure is that it also has to start from the higher ups. There should be buy-in from the powers that be, and enforcing protective policies and whatnot. In fact, in 1987, particularly in long-term care settings, we have the Federal Nursing Home Reform Act. And if you read the detail of that act, it hones in on the fact that you have to provide inclusive and affirming care to everyone, regardless of what their identities are. Now, that being said, are the facilities, healthcare facilities like long-term care settings and rehab and whatnot, are they actually adhering to that? That remains to be seen. So it also applies to acute and outpatient practices as well, that we have the language and the laws to enact, but whether or not that actually is translated and operationalized at the at day-to-day practice, again, we're not 100% sure. So I think that if we're talking the talk, we have to walk the walk as well. So I think those are just some concrete ideas in terms of inclusive and affirming care.
All right, Dr. Wang, you have the floor. I don't know if there's anything else to add about trans-inclusivity in healthcare.
Yeah, I have not much else to add. Everyone covered everything that is important in order to provide gender-inclusive healthcare. But I think everyone was also very practical. So I'm gonna do the dreaming part of dreaming big, in which I think there is a potential for healthcare to just be reimagined, and so that it is truly community and patient-driven. Right, so it's not people in administration, it's not clinicians, it's not from the provider part that is imagining what healthcare should look like, but it is from the patient, from the community, to say this is what's important, this is what works for me, and this is what I want my care to look like. So that's my dream answer.
That's my dream answer too. Thank you so much, and thank you everyone for acknowledging. I think it's really important to acknowledge anti-Blackness, and colorism definitely does play a role in discrimination that we see in healthcare. So I really appreciate that. Thank you. Now we're gonna talk about the elephant in the room, everybody's favorite topic, which is gender affirming care. We know that gender affirming care is medically necessary. However, there's been a lot of misinformation, right? Especially from anti-trans policymakers, such as what's happening to Medicaid in Florida, claiming that gender affirming care is experimental. In your own words, as providers and clinical experts, what are your perceptions of gender affirming care? What is it that you want people to know when it comes to gender affirming care? And I will first pick on Dr. Javier on this question, if you don't mind sharing your thoughts around that.
So I'm definitely 100%, supportive, more than 100% supportive of gender affirming care. I myself am a recipient of that, and I could not be more grateful and humbled to be able to receive the care that I have. I certainly realize that, to be able to carry this identity, in my situation, is also a serious responsibility for me. And this is the reason why I showed up, in this panel in the first place, because I do feel that, I'm in a privileged state because I have the status, the means, the resources, and, the protections that are afforded, towards me and by me. So I'm incredibly grateful for that. At the same time, I also am sympathetic, empathetic, and would like to continue to champion, because I know that there's a lot of disparities and inequities around gender affirming care. And let's not forget, I live in a city that is considered a sanctuary state, right? And not people from other states, particularly in the South and the Southwest, may not necessarily get the same level of protections. In fact, we know for a fact that there are 29 states that have that still have non-discrimination, non-discrimination protections for LGBTQ people at large. So, gender affirming care has a significant impact on, especially for individuals who desire to pursue gender affirming care. Let's also be clear about that. Trans and non-binary, gender non-binary individuals who desire to pursue gender affirming care, because it not only addresses the dysmorphia that people, the body dysmorphia that people experience within themselves when there's that misalignment as far as their gender or sex assigned at birth and their gender identity, but also the fact that there is significant mental health outcomes. We know this for a fact, and there's a social scientist by the name of Ilan Mayer who's really wonderful and has just done wonderful work. And back in 2003, he outlined and created this algorithmic, concept or framework around minority stressors, leading to significant physical and mental health outcomes. But what is underneath the minority stressors is the fact that it's an aggregate effect of the general stressors that people have to contend with on a day-to-day basis, whether it's their education, employment, and then as a minority individual, they have to contend with their own unique minority stressors, whether it's internalized transphobia, perceived transphobia, or outright discrimination. So that leads to significant mental health outcomes, depression, suicidal ideation, and suicidal attempts, and generalized anxiety, post-traumatic stress, you name it. There's enough data to support that, individuals who have actually received gender-affirming therapies are life-saving interventions for all. And I'm not just talking from an adult perspective, but I'm also talking from really across the spectrum, from the pediatric adolescent to the older adult population.
Thank you. Anything to add to that, Dr. Jackson?
Yeah, I think that really all care should be gender affirming care, right? Any care that we provide should be affirming of someone's basic human dignity and basic human, right to decide who they are and to be who they are. Specifically, when it comes to gender affirming hormone therapy or gender affirming surgical care, these things are not experimental. They have been used for decades in youth and in adults. And trans people certainly are not new. We have existed since the dawn of time. And for the vast majority of that time, our own communities found ways to affirm each other. In many cultures throughout the world and throughout history, we were not denigrated, we were celebrated. And so it's really a relatively new phenomenon that we are medicalized and treated in healthcare settings for the condition of being people who we are. And so these treatments, although they might be a new idea to some people, newly exposed to these ideas, they are not new. And they are life-saving and really are a beautiful tool to give people the ability to be who they are and, determine their own destiny and live the life that they desire to. And it's a really beautiful thing and a huge honor to be able to provide to people. But certainly, not a new concept and a very safe evidence-based practice.
Thank you so much. Jonah, anything to add on your thoughts on gender affirming care and just the misinformation?
Yeah, I really liked what Dr. Jackson said about it being sort of a beautiful kind of care. I really love what I do because since we work in a very diverse model, I see a lot of different kinds of patients. I do a lot of different kinds of care, but gender affirming care holds a special place in my heart. I love working with other trans folks. I love the excitement of like when trans folks get to see someone who's also from the gender diverse spectrum and feel like they're seen in that. And I think that's really amazing. And I think what is just really, when we're talking about the misinformation with this issue, I think that it's just so funny to me because I think the reason why people get so up in arms about it is because they're exposed to so much of like the small parts of what gender affirming care is. And I think that, if people, like when people are newly diabetic or have all kinds of new diagnoses, they're very surprised at like what medical care can look like. People are very surprised at what modern medicine can do. And I think that there's a lot of different forms of care that might shock people. But I think it's that there's just this specific attention to gender affirming care right now that's really rooted in stigma. And I think there's also so much focus on youth care. And this idea of like basically like unwilling youth having like harm done to them. And what's interesting is that I really like what Dr. Jackson said also, that like there's a lot of other kinds of gender affirming care. Youth in America for many years have been able to do all kinds of plastic surgery with their parents' consent. That is in a way gender affirming, just gender affirming usually of their own cisgender. And no one has ever batted an eye at that. You don't see that as a talking point in political debates, etc. You don't see it weaponized against people. And so I think that when we're thinking about gender affirming care for youth, it really is just rooted in stigma. It's really rooted in like using this idea, our cultural love of children, our cultural belief that children need to be protected against us, and weaponizing it in a very unique way that's unnatural to us because we believe in all kinds of care that are affirming already. And we were already used to that regardless of where we might fall on the political spectrum.
Thank you, Jonah. Dr. Wang, I think you're the last person to answer this question. Go ahead and take the floor.
All right, thank you. Yeah, so the attacks on gender affirming care reminds me of all of the hearings on abortion care where, or the attacks on abortion care where they say, oh, abortion happens until the time of delivery, right? And it's just, this is not a thing that happens in medicine. And all of the attacks on gender affirming care are also, these are not things that happen in medicine, right? Like these are not things that happen in healthcare. So I just want to like first just say that when it comes to evidence, there are there are two ways of understanding it, right? There is what is on a medication label, and what gets on a medication label and what diagnosis gets on a medication label takes money. It takes a lot, like millions of dollars. And so often in medicine, we are conducting research studies to figure out, okay, so we found that this medication has a side effect, which is actually really helpful for our patients who have an unrelated diagnosis. So let's do a study to figure out if that's actually effective. But most of us who are doing these studies, right, are in academics. We are not we are not pharmaceutical companies. We don't have millions of dollars. And so we can't pay the FDA to say, hey, let's get a new diagnosis on this label. And so that's with a lot of medication and surgeries that we do for transgender care, right? Like we don't have the money to get this on the label, but we do have the research to back this up. And I also want to just acknowledge that much of this experience comes from trans people themselves, right? And it's like just finally like trans people like yelling and saying like, hey, this is like what we need for ourselves and this works for us. And then finally the medical community was like, oh, hey, okay, yeah, we think there's something in here and we're right. And let's like take a look at this. And so just acknowledging like all of the work and the labor, the blood and sweat of trans people, especially of trans people of color who have pulled the medical community, the healthcare community to this point. And I think the other piece is I just have so many young people who I've seen for their first appointment in order to start hormones, and they are so shut down, right? And they're so shut down. They can't look at me. They can barely like answer my questions. And then there are also moments where I see people like just like shaking with fear, right? Because they're so worried about like that I might yell at them, that I might ask them invasive questions, that I might make them do an exam that they're not ready to do. And then I just, really engage with them about like what is important to them, what knowledge do they have. I go through the benefits, the risks of hormones, right? We go through all of the information together. And then after we start hormones, like a few months later, I see them, right? And I almost like think of them like as a little bud when they first start off, right? Like they're really closed off, and then like slowly they start blooming, right? And like with each visit, they bloom more and more. And then like 6 months in, a year in, I like finally see who they want to be on the outside, right? And they're like just glowing with happiness. And so like we have the research that backs up how important gender affirming care is, but I think all of us as providers of gender affirming care, we see it on a daily basis of how important and how life affirming gender affirming care is. So I have patients in Florida now. So I provide telemedicine in Florida. And I have patients who are so fearful of losing their access to hormones and to surgery, right? And so for me now is just trying to think of like, how do I support them through this period? How do I, like, what is possible within the limits of the law? And it's really, really hard. And so I think for us, like these types of like non-discrimination laws that come from the top down, right? Like from the federal to the state, to the districts, like to our healthcare systems, these are so important and so necessary.
Thank you, Dr. Wang. So I'm going to open up for questions. I see that there's, I think, 2 of them. The first one, one of the commenters wanted to know what can they do to avoid unpleasantness for trans patients who just endured surgery and want to be better supported when there's nurses and staffers who misgender and dead names. I don't know if anyone wants to share tips for people who are about to get surgery. I definitely need to write these tips down because I'm preparing for my own surgeries as well. So I don't know if anybody who wants to take on this question. Okay, go ahead.
I can take this on, also preparing for surgeries myself. I think this comes down, it's rough. It's certainly rough. I've received this feedback about patients we've sent out for care before. And there's no, like, it's a extremely uncomfortable experience. I want to first validate that. And the problem is that what I think really the solution is that I've often had to tell people is just so difficult, because especially if you're in that harm state, you just want to forget about it. You want to do something. But it all starts with, like, every hospital has a feedback trail system. And if you're working with a gender affirming surgeon, it's really part of it is also if they're going to provide that surgery and use that hospital, then they need to make sure that it's a safe space for their patients. And so giving that feedback directly to the surgeons and asking for the feedback trail when you feel safe to do so, and give it time if you need to. I think is the most important thing. And what I hate about that is it's asking people who've experienced the trauma to do the work, which is not fair. Again, I want to validate that it's not fair. But in my experience, it's the only thing that works. And in my experience, I have seen it lead to positive outcomes, lead to mandatory trainings for emergency departments. Especially, I think that I've seen it, at least in my sort of progress through healthcare, a lot of emergency departments that have especially also been a space that have not been safe for trans people. It's led to trainings for more nurses. And, you know, I like one training's not enough. I think that hospitals forget that. I think they get a single complaint, they do a training 1 year. And like Dr. Javier was talking about earlier, they need to make sure that they continuously do that. So that way new employees are getting that and it's being reaffirmed. But I think it starts with making our voices heard when you feel safe to do so.
Yeah, I'm going to piggyback on Yona's comment on this. Thanks, Yona, for that wonderful tip or tips. I think we definitely need to speak up, you know, as they say, you know, if you need to, if there is a problem in the air, you need to put your life vest first. And this is what we're doing. So we need to speak up. And I realize that it's in a vulnerable time. When working with post-acute care unit staff, there's always a nurse manager. So you can always escalate that. You know, that's part of the feedback trail to speak up and, you know, let that feedback trickle in and have the nurse manager be aware, and also the surgeon, as Yona was referring to, and the team, because you're absolutely right. I think that was Claire who gave that question, that, you know, a lot of the times, perhaps the surgeon's team is in the know in terms of how to treat a non-binary and a trans person, but then other staff members do not necessarily are in that headspace. So I think speaking up and providing that feedback is really an important tip.
Anything else to add with the rest of the panel, or are we good with this answer?
I think the only couple things I would add, we certainly, we can't know what we don't know, and we don't know what happens when we're not there. So escalating it is an excellent idea. Also, most hospital systems will have a patient advocate type of system, who is somebody who is not a provider or a nurse, who is simply there to like help you navigate problems like this. So you can always ask to be connected to those folks. I also hope that there are some providers and healthcare workers on the call right now. And I think in so many areas, we often feel nervous to make mistakes and kind of paralyzed that we are going to do something that will offend somebody, or we see something offensive happening, but we don't necessarily have the language to correct it. And, you know, trans people in any healthcare setting, but especially after surgery, need all the things that normal people, like everyone needs after surgery, right? They need pain control. They need to get up and walk around. They need to use the bathroom. They need just like love and tender support, because going through a big surgery is a really hard thing to do. And so you can always provide all of those things to anybody. You already know how to do that for a lot of people. You just have to do that for trans people too. And it's always okay to speak up if you see something happening in your workplace that isn't right, right? Like you can address it with your coworkers, you can escalate it to your manager, you can escalate it to your HR. This really shouldn't be all on patients to have to correct.
Any last words on this question, Dr. Wang, or are you good?
Yeah, I saw a comment about escalating to risk management, so that's also a good option. And I lost the thread a little bit about whether this was someone in support of a patient or whether from a patient themselves. But if this is from a patient, that I would say talk to your surgery team beforehand about sort of what they would recommend that you do. And then also, I think we're at a point in the pandemic where most people having surgeries are able to bring a support person with them. And so just kind of like focus on your recovery and then have your support person be there to do those types of things for you.
Awesome. I think we only have time for one more question. This is a question from Maya. I think it might be appropriate with Dr. Javier working in New York City. But with the understanding of New York City being a sanctuary state, many are migrating for healthcare. And we saw with HIV treatment, what is being done to address the homelessness and service needs of individuals migrating for safety and affirming healthcare? And this question can go to any of you all. I don't know if anyone has really an answer to such a complicated system that we have, but I wanted to ask you all.
Yeah, I can probably start with that. Thanks, Maya. That's a very loaded question, and thank you for a tough loaded question. What I can say is that, well, you've seen the news about the buzzing, from all different states going to New York City. So what I can probably say about my state is the fact that, or particularly New York City, is the fact that our mayor is Eric Adams is definitely committed and invested in making sure that we address the problems of homelessness. I can't give you an answer right now, specifically in terms of the tangibles of it, because I don't have all that information, but I can certainly read up more and fill you in. But from the information that I've gathered from the news, people are aware, particularly in our state government, that they are aware about the increasing homelessness and the fact that there are immigrants who are coming into the city and are seeking a sanctuary here. So I know for a fact that the mayor and his government are really trying to find ways to provide access to healthcare. I think we're still in the beginning stages of this, because we also have to think about some of the other domains like housing and making sure that they have access to basic things, clothing, shelter, and so forth. But that is within the purview, and I know that they're committed into acting on this.
Thank you. Does anyone else have anything else to add before we close to our final question? No? All right. Thank you again for all of your time and sharing your experiences. I guess the last question I have for all of you is, why do you think it's important for people to participate in our campaign, Protect Trans Health? That's why we're here, is to discuss this. I'll start with Jonah. Why do you think Protect Trans Health is important?
It goes back to what we were just talking about. I always think it's important to make sure that our voices are heard. And I know that you guys have really been hammering hard that we're outnumbered 3-1 in terms of the comments right now. And I think that we need to show that people do care about this issue, and that we haven't gone to sleep, that we're activated, we're ready to continue the fight, because it's when we aren't activated, when we're not engaged, that things continue to slide back. And I think that's why this is so essential. I think that, I don't think that this non-discrimination protection is the end-all be-all. I think it does a lot of great things. I certainly think that it's going to take us decades upon decades to try and root out so many of the sources, the structural inequities that are the root cause of all these things. But I think this is sort of the next step. And I think that if we can embrace that, and be joyful about it, and be joyful that we're given a situation where we can make our voices heard, and that there's an administration that wants to listen to us, I think that we have to take it for all that it's worth.
Thank you so much, Jonah. Again, also Dr. Wang, why do you think this campaign is important, and why is it important for people to submit a comment?
Yeah, to add to the important comment that Jonah already made, I just want to recognize that trans people, non-binary people, in particular Black trans women, have been at the forefront of their own liberation, right? And that as a healthcare provider, as an aspiring ally, I am there to just do what I can to further these efforts. And so for us, like we all, right, it is important for us to speak up and to like quiet, to override, right, to really just suppress all of these really hateful comments that are out there, and to really be in support of health, of life, of liberty, right, of people just living their lives.
Thank you so much. Dr. Jackson, why do you think it's important to protect trans health, and why is this campaign important?
Yeah, absolutely. Echo the sentiment that trans women of color have been out there really like pushing us to pushing the trans community and the general community to honor trans people and to really like take our rights back and give our communities what we need. But they can't do it alone. We can't do it alone. We need everyone who supports us to speak out in that support, right? I really do believe that the vast majority of people want us to thrive in this world, but we all need to show up and show the people in charge who make these rules that we care about trans people, so that a vocal minority aren't the ones who dictate how we're cared for.
Thank you so much. And last but not least, Dr. Javier, what are your thoughts on Trans Protect Health and Protect Trans Health? Ooh, excuse me, it's been a day. And why do you think this is important?
Well, thank you so much for that question, Devin. I think because I'm going to give a simple answer, because we're all people and healthcare is universal, regardless of how you identify. I could not be more emphatic than that. And that's a basic human right. So if we see each other as all human beings, regardless of our identities, then there should not be any debate, because we don't debate about food and access as human beings. We don't debate that there is a need to find shelter. It's the same thing with healthcare. It's that plain and simple. Thank you.
Thank you. Please, everybody, submit your comment. Even if you don't have a story, share your support and go over to www.protecttranshealth.org and submit a comment for us. And thank you, everybody. I appreciate your time, your valuable time in this space. And thank you for everything that you do. I really appreciate it. I hope everyone have a good night. Thank you.
Thank you. Good night.
Thanks for having this and putting it together.
Thanks, everyone.